Hello everyone and welcome back to Easy Dentistry, a channel that makes dental education incredibly easy and interesting. Before we begin, please subscribe to our channel, like our videos by giving it a thumbs up, do comment and let us know what you think about our videos, and most important of all, don't forget to share these videos with your friends. Today, a very important topic for discussion is macrolide antibiotics. So, without wasting any time, please let's begin with today's lecture. So, here we will study about the introduction to macrolide antibiotics, and then we will be studying in detail about the erythromycin, roxithromycin, clarithromycin and azithromycin. So, the introduction to the macrolide antibiotics. Macrolide antibiotics are the antibiotics with macrocyclic lactone ring with attached sugars. These are used since 1950s. The first one introduced was erythromycin. But because the limitations of erythromycin, which were narrow spectrum of activity, gastric irritation, gastric acid liability, low oral bioavailability, reduced tissue penetration and reduced T half of the drug, there was a necessity to develop some antibiotics to overcome these limitations. So, semi-synthetic macrolides were introduced, namely Roxithromycin, Clarithromycin and Azithromycin. Now, let us study erythromycin in detail. It was first introduced in 1952 and was obtained from Streptococcus erythraeus. Erythromycin can be used as an alternative to penicillin. It is frequently used in dentistry. Talking about the mechanism of action, at low concentration, erythromycin is bacteriostatic, while at high concentration, it is bactericidal. Increased activity of erythromycin can be demonstrated in alkaline medium. Now, the bacteria which are sensitive to erythromycin, namely the gram-negative bacteria, through active transport accumulate in erythromycin intracellularly, and this increases the susceptibility of the organism to the antibiotic. Now, erythromycin, it binds to the 50S ribosome and interferes with translocation. So, the mechanism of action of erythromycin is decrease in the protein synthesis in the organisms. Now, the antimicrobial spectrum of erythromycin, it has relatively narrow spectrum of activity. Mostly gram-positive organisms and few gram-negative organisms are inhibited, and the spectrum of activity, it considerably overlaps with penicillin. The drug is highly active against Streptococcus pyogenes, Streptococcus pneumoniae, Neisseria gonorrhoeae, Clostridia, Corynebacterium diphtheria and Listeria. The drug is moderately active against H. influenzae, H. ducreyi, B. pertussis, Chlamydia, Streptococcus viridans and N. meningitidis. And the bacteria which are not inhibited by erythromycin are Enterobacter and Bacillus fragilis. Now, how do the organisms develop resistance to erythromycin? There are various mechanisms. The first one is that all the cocci, they develop resistance to erythromycin by attaining a capacity to pump out the erythromycin from the cell body. Another mechanism by which Enterobacter acquires resistance to erythromycin is by production of an enzyme erythromycin esterase. And thirdly, the mechanism for developing resistance is alteration of the ribosomal binding site for erythromycin. Now, this alteration is mediated by plasmid encoded methylase enzyme. So, these are the three mechanisms of resistance development to erythromycin. Now, cross resistance is also observed for macrolides, clindamycin and chloramphenicol. This cross resistance occurs because the ribosomal binding site of erythromycin are very close to the ribosomal binding sites of other macrolides, clindamycin and chloramphenicol. Now the pharmacokinetics of erythromycin. Erythromycin is acid labile. So to protect it from the gastric acid, it is provided as enteric coated tablets. But because of this enteric coat, there is incomplete absorption of the drug. Now, acid stable esters of erythromycin have shown to have better absorption. There is wide tissue distribution of the drug. The drug has a capacity to enter into the abscesses, cross the serous membranes, cross the placenta, but it cannot cross the blood-brain barrier. There is 70 to 80% plasma protein binding shown by the drug. Erythromycin is metabolized and excreted in bile primarily. Renal excretion of erythromycin is minor and plasma T-half of the drug is 1.5 hours. The adverse effects: erythromycin is considered relatively safe, but mild epigastric pain and diarrhea may occur in children. High dose of the drug may result into reversible hearing loss. Hypersensitivity reactions, rashes, fever and allergic reactions may occur, but they are rare. Now, the interactions of the drug. Erythromycin reduces the hepatic oxidation of many drugs. Increased plasma level of certain drugs are seen with concurrent administration with erythromycin. The drugs which show this increased plasma level include theophylline, carbamazepine, valproate, warfarin, terfenadine and estimizole. Now the uses of erythromycin. Dental infections. It is the second drug of choice to penicillin for periodontal and periapical abscesses, acute necrotizing ulcerative gingivitis, post-extraction infections and gingival cellulitis. Medical uses of erythromycin is in pharyngitis, tonsillitis, other RTIs and ENT infection, and erythromycin is the drug of choice for atypical pneumonia, whooping cough and chancroid. It is the second drug of choice for Legionnaires' pneumonia, Campylobacter enteritis and chlamydial infections of the genital tract. Now, the second macrolide antibiotic we will study is the Roxithromycin. It is a semi-synthetic macrolide antibiotic having longer action and it is acid stable. The spectrum of activity is very similar to erythromycin. It is more potent against B. catarrhalis, G. vaginalis and Legionella. It is less potent against B. pertussis. Roxithromycin has shown improved enteral absorption. The plasma T-half of the drug is 12 hours. There is better gastric tolerance and reduced drug interaction. Now, Roxithromycin can be used as an alternative to erythromycin in respiratory infections, ENT infections, orodental infections, skin infections, soft tissue infections and genital infections. Now, the next macrolide antibiotic is Clarithromycin. The spectrum of activity of Clarithromycin are all bacteria sensitive to erythromycin and in addition to it Mycobacterium avium, atypical mycobacteria and Mycobacterium leprae are also affected. It is active against oral anaerobes like Bacillus melaninogenicus, Streptococcus, Clostridium, Moraxella and Legionella. It is acid stable, shows rapid absorption with 50% bioavailability with wide tissue distribution. T-half at low dose is 3 to 6 hours while T-half at high dose is 6 to 9 hours. Uses of the drug. in upper respiratory and lower respiratory tract infection, skin infections, orodental infections, sinusitis, otitis media, and atypical pneumonia. Now, here one thing to be remembered is that clarithromycin is a component of the triple drug regimen which eradicates H. pylori in 1 to 2 weeks. Then it is the first line drug for the Mycobacterium avium infection and AIDS. It is the second line drug for atypical mycobacterial diseases and leprosy. The side effects of clarithromycin are similar to erythromycin, but it shows better gastric tolerance, less hearing loss, less amount of enterocolitis and hepatic dysfunction. Now, the last drug in the macrolide antibiotic group is the azithromycin. It is an azolite congener of erythromycin and it has extended spectrum of activity and improved pharmacokinetics. It has better tolerability and better drug interaction. It is highly active against H. influenzae, Peptostreptococcus, Clostridia, Mycobacteria, Chlamydia and Legionella. It is not active against gram-positive cocci and all erythromycin-resistant bacteria. Pharmacokinetics of azithromycin, it is acid stable, shows rapid absorption, large tissue distribution and intracellular penetration. Uses of azithromycin is in orodental infections. Better activity against spirochetes and gram-negative anaerobes is seen. It is the second drug of choice for prophylaxis of post-dental surgery, wound infections or endocarditis. It is the first drug of choice for Legionnaire's pneumonia and chlamydial infections of the genital tract. Other uses of azithromycin is in pharyngitis, gonorrhea, tonsillitis, chronic bronchitis, sinusitis, skin infections, otitis media and pneumonia. Side effects include mild gastric upset, abdominal pain, headache and dizziness. So here we complete our discussion on the macrolide antibiotics. Hope you understood the lecture. The next lecture is on a very important topic, that is the anti-tubercular drugs. If you don't want to miss the lecture, please subscribe to our channel right now and happy studying.